Okay, good day once again, everybody. We are going to continue on the physical assessment, and this time we are going to tackle about the abdominal assessment of the human being. The abdomen has anatomic divisions. This includes the abdominal quadrants, abdominal wall muscles, intestinal anatomy of the abdominal cavity. The abdominal quadrants include your right upper and lower quadrants and your left lower and upper quadrants. Take note, when you say midline, this refers to the line that runs from the tip of the sternum down to the umbilicus and further to the symphysis pubis. When you say lateral, on the other hand, this is a line that runs through the umbilicus across the abdomen. As you can see here, you can see the two lines. Okay? In each quadrant, you can find different organs under it. Here is your right upper quadrant, right lower quadrant, left lower quadrant, and your left upper quadrant. This is what you call the costal arch. And you can find here at the bottom is the pubic symphysis. Under the right upper quadrant, you can find the liver, gallbladder, duodenum, pancreas head, right kidney, and the adrenal gland. In the right lower quadrant, you can find the cecum, appendix, right ovary, and the tube. Left upper quadrant, there lies the stomach, spleen, pancreas, left kidney, and the adrenal gland as well. In the left lower quadrant, you can find the sigmoid colon, left ovary, and the tube. The abdominal wall muscles. It has three layers: external abdominal oblique, the outermost; internal abdominal oblique, found at the middle; and your transverse abdominis, innermost. Okay? And in this illustration, you can find the three: the outermost, external oblique; internal oblique in the middle; and then your transverse at the middle. Okay. I'm sure you have tackled this in your anatomy class, so let's skip to the next slide. Internal anatomy. It includes the parietal peritoneum, which is a thin, shiny serous membrane which lines the abdominal cavity. Okay? When you say visceral peritoneum, it provides a protective covering for most of the abdominal organs. When you say solid viscera, this maintains the shape and consistency. This refers to kidneys, pancreas, ovaries, and uterus, liver, and adrenal glands. When you say hollow viscera, this refers to the change shape depending on their content, such as in the stomach, gallbladder, small intestine, colon, and your bladder. Here you can find the anatomy in this photo. This is your gallbladder. You have your esophagus, pancreas, stomach, large intestine, small intestine. And the little one here is your appendix, which they say is part of your defense mechanism of the body. Okay, moving on. Previously, it was mentioned that there were 4 quadrants. Here you can find the 9 abdominal regions. Each region, again, under each region, you can find different organs or part of the abdomen. Let me show you. In this region here, if you see the cursor, you can find a right hypochondriac region. Down, next is the right lumbar region, and lowest is the right iliac region. On the other side, you can find the left hypochondriac region, left lumbar region, and lowest is the left iliac region. More or less a mirror of the other side. But at the middle, you can find epigastric region right here, and then the umbilical region, then hypogastric region. Now, and again, like what I said, in each region you can find the different organs. Let's start at the right hypochondriac. You can find the liver. Okay, it's right here, a portion of the liver. And then your right kidney, your gallbladder here, and the large or part of the large and part of the small intestine behind this. At the right lumbar region, there is the ascending colon, your small intestine, yeah, part of it, and the right kidney behind. The right iliac region, you can find appendix here, and then the cecum, and then part of the ascending colon and the small intestine partly. On the other side, you can find at the left hypochondriac the liver's tip here, and then stomach, pancreas, left kidney at the back, the spleen, large portions of the large and small intestine. At the left lumbar region, there is the descending colon, small intestine, and the left kidney. The left iliac region lies the sigmoid colon, descending colon, and the small intestine. At the epigastric region, you can find the liver, stomach, spleen, duodenum, adrenal glands, and pancreas. In the middle, the umbilical region, there lies the duodenum, small intestine, and the transverse colon. At the lowest portion and in the midline is your hypogastric region. The bladder, sigmoid colon, small intestine, and reproductive organs are found here. Developmental, cultural, and ethnic variations. When you say developmental, of course, we start from being infants. The newborn's bladder is located above the symphysis pubis at this stage. And the liver proportionately takes up more space in the abdomen and may extend about 2 centimeters below the rib cage. Because the infant's abdominal muscles are weak, the abdomen normally protrudes. This way, we can see that the abdomen of the infant seems to look like a barrel. In our terms, we call this shape barrel chest. In children up to 12 years old, by the way, when you say infants, that is 0 to 12 months. Now, children up to 12 years old. This includes your toddlers, preschoolers, and the rest up to 12. Now, their abdomen is proportionately larger than an adult's and has a slightly protuberant appearance because of the curvature of the back. Mura na siya galiad, no? Gamay. This protuberance is most obvious in toddlers and preschoolers and diminishes to adult proportions during adolescence. This is because abdominal muscles are underdeveloped and organs are more easily palpated. In pregnant women, the abdominal muscles relax, allowing the uterus to protrude during a normal pregnancy. For multiple pregnancies, the rectus abdominis muscles become separated. This, as the fetus grows, it takes up even more room in the uterus, causing the stomach to rise up and impinge the diaphragm. Bowel sounds are diminished at this stage. And there is a decreased activity in the lower GI tract. There is prenatal vitamins, which causes constipation in pregnancy. Increased venous pressure in the lower abdomen. Hemorrhoids may also develop following constipation. Then linea nigra, a darkly pigmented line that appears on the anterior abdomen. That's from the umbilicus down. It starts to appear. There is a striae from the increased tension of the expanding uterus. In older adults, as people age, many of their body systems slow down and become less efficient. In elderly people have changes in dentition that may affect their chewing ability and digestion. Of course, right? As we can see, older people, um, there's less calcium in their body, and the bones become brittle, right? So, also there are dental problems that may occur in old age. There is poorly fitted dentures. These may result in painful mastication or chewing, which causes the patient to select food that are easier to chew but not necessarily nutritionally balanced. In the GI tract, there is a reduction of saliva, stomach acid, gastric motility, and peristalsis that causes problems with swallowing, absorption, and digestion. These changes, along with a general reduction of muscle mass and tone, also contribute to constipation. Fat accumulates in the lower abdomen in women and around the waist in men, making physical assessment of the organs a little more challenging for us. And the liver becomes smaller, and the liver function declines, making it harder to process medications. Assessment. In subjective assessment is qualitative, and objective assessment is quantitative. The nursing health history. First, history of the patient, of the present health concern. Okay, history of present health concern should be considered. Then the past health history of the patient. Did the patient have any ailments prior to the complaint or admission? Then we should also check the family history, the background of the patient. Is there any, any genetic problem that the family line has? And then, of course, there is the lifestyle and health history. Okay, the way of life, the ADLs, the food that the patient takes in. These should be considered. The history of present health concern, or otherwise they say history of present illness. There is abdominal pain, there is indigestion, nausea, the feeling of wanting to vomit, and vomiting. There is an appetite problem. There is bowel elimination problems as well. Then there is abdominal pain. Remember, we are assessing the abdomen. What factors contribute to this? First is chemical or mechanical. There's inflammation, distension, pressure, trauma, being hit, infection, and overstretching or stretching of the organs in the abdomen. Guide in eliciting information about current symptoms. Please remember the cold spa. Okay? C. Character. How does it feel? Look, sound, or smell? Check it out. O. The onset. When did it begin? L. Where is it? Where is it located? Does it radiate? Does it move from one region or to another? And then you should also check the duration. How long does it last? Does the pain last, or the throbbing pain or the piercing pain, does it last long or short? Does it keep on coming back? You ask that. Okay? Does it recur? S. Severity of the pain. Here is where you can use your pain scale from 1 or 0 to 10, with 10 as the most painful. You ask the patient, how bad is it? How painful is it? Okay? If it's a 10, that means it's really, really very painful. Then you ask about the pattern. What makes it better? What makes it worse? If you take in this medication, does it make it better? What happens? Or What makes it worse? You also take note of that one. And then you check the associated factors. What other symptoms occur with it? Okay? Make sure to document your findings. Then, the types of pain. There is visceral pain, parietal, and referred pain. In visceral pain results from the distension of the intestines or stretching of the solid organs. Okay? It is a result of that. It is often described as burning pain, cramping pain, diffusing, and poorly localized. Parietal pain is a result from inflammation of the parietal peritoneum. The pain is usually severe, localized, and aggravated by movement. By the way, in assessing pain, you also check the facial grimace of the patient. If they move and there is facial grimace, then that's probably really painful. And the last one is referred pain. Referred pain is felt at a site away from the site of origin. Impulses from the internal organs and structures that share nerve pathways inside the central venous system explain the nature of referred pain. Then you also assess the past health history. This helps the client to identify that he had or has had any history of this ailment. Also check for family history because the client awareness of family history can serve as a motivation for health screening and positive health promotion behaviors. Then there is lifestyle and health history. The data focuses on symptoms of a particular abdominal organs and the function of the digestive system along with the aspects of nutrition, usually bowel habits and lifestyle. Collecting objective data. Purposes of abdominal examination. A. It is to explore gastrointestinal complaint. It is also to assess the abdominal pain, tenderness, and masses, and to monitor the client post operatively. After the operation, we monitor the patient in the recovery room or at the post anesthesia care unit or PACU. Some people pronounce it as PACU. Then there is assessment procedures. In the abdomen, it's different. There is only inspection, auscultation, percussion, and lastly, we do the palpation. There are two types of palpation. There is light and deep palpation. Okay. You auscultate after you inspect as not to alter the client's pattern of bowel sounds. After this presentation, I want you to check out the videos because in the video you can find and hear the actual bowel sounds. Please be familiar with it. Okay? Before touching the abdomen, ask the client about painful or tender areas. These areas should always be assessed at the end of the examination. Preparing the client. Perform the abdominal examination in a warm, private environment. Remember, provide privacy. Adequate lighting for better visualization. Draping is to remove the clothes and put on the gown. Remember, provide privacy. And the equipment. What you need is a flat pillow for comfort, a rolled blanket to help relax the abdominal muscles, and a centimeter ruler, stethoscope, and marking pen. You will use this in measuring the the liver rather. Ask the client to empty the bladder first to eliminate bladder distension and interference. The position of the patient is to help the client to lie. You should help the client to lie supine with the arms folded across the chest or resting by the sides. Raising arms above the head or folding them behind the head will tensen up the abdominal muscles. Instruct the client to breathe through the mouth. Sorry, this is breathe. Breathe through the mouth and to take slow, deep breaths. This promotes relaxation. Number 1, inspection. Inspect the skin of the abdomen, the color, vascularity, striae, scars, lesions, and rashes, other growths. You have to assess this integumentary part. Then the umbilicus. Check the umbilicus or umbilicus, the color, its location, the contour, and if there are discharges. Then assess for symmetry in abdominal girth and considerations. Okay? By the way, you have to take notes when you do this. And then also check for the movement. There's aortic pulsation and peristaltic waves. Auscultate for bowel sounds, friction rub, vascular sounds. You might wonder how does these sounds sound like, right? Well, you will hear that in the videos, so do check them out. Then percussion. The percuss for the tone, span, or height. Remember, for the dull and tympanic sounds, where can you find the dull sounds? Okay, you can find the dull sounds over bones, right? Tympanic over most hollow organs. Palpation. Palpate for masses, bulges, or swelling, even for tenderness. Inspect the abdominal contour. Look across the abdomen at eye level from the client's side, from behind the client's head, and from the foot of the bed, from different perspectives, in other words. Assess abdominal symmetry. Look at the client's abdomen as she lies in a relaxed supine position. Auscultate for bowel sounds. Begin in the right lower quadrant and proceed clockwise. Okay? You start from the right lower quadrant. Clockwise, you go to right upper quadrant, left upper quadrant, and lastly to your left lower quadrant. For vascular, you have to do this for vascular sounds. Use the bell of the stethoscope over the abdominal aorta, at the renal, iliac, and femoral arteries. I'm sorry about the spelling of this one. Percussion for tone. You use your plexor and pleximeter. That is indirect percussion. Sequence may proceed clockwise or and down over the abdomen. Percuss the spleen. Begin posterior to the left mid-axillary line and percuss downward. Percuss the liver. Begin at the right lower quadrant and percuss upward towards the chest. The video shows that very clearly. You have to measure the liver, whether it is not in its original size. Okay. Next, perform light palpation. This is used to identify areas of tenderness and muscular resistance. Using the fingertips only, begin palpation in a non-tender quadrant and compress to a depth of only 1 centimeter in a dipping motion. Remember that. Deep palpation, on the other hand, is used to delineate abdominal organs and detect subtle masses. Using the palmar surface of the fingers, compress to a maximum depth of 5 centimeters to 6 centimeters. Okay. Palpate the aorta. Use your thumb and first fingers, or use 2 hands and palpate deeply in the epigastrium, slightly to the left midline. Palpate the liver. Stand at the client's right side and place your left hand under the client's back at the level of the 11th to 12th ribs. Palpate the kidneys. The right kidney, support the right posterior flank with your left hand and place your right hand in the right upper quadrant, just below the costal margin at the MCL. Palpate the urinary bladder. Begin in the symphysis pubis and move upward and outward to estimate bladder borders. Now, you follow the assessment procedures. Okay, you have the checklist with you, and do check out the videos because you can see everything so clearly there. If you have questions or inquiries, feel free to send a message. Thank you for listening and God bless.